Bipolar disorder, symptoms and overview. Bipolar disorder, often misunderstood and shrouded in stigma, is a complex mental health condition that profoundly affects those who suffer from it. This article seeks to demystify the condition by delving deeply into its symptoms, causes, diagnosis, and treatment options. What is bipolar disorder? Bipolar disorder, previously known as manic depression, is characterized by extreme mood swings that include emotional highs, mania or hypomania, and lows, depression. These mood swings can impact sleep, energy, activity, judgment, behavior, and the ability to think clearly. Episodes of mood swings may occur rarely or multiple times a year, and they can vary in duration and severity. Bipolar disorder requires lifelong management, which often involves a combination of medications and psychotherapy. What are the symptoms of bipolar disorder? The symptoms of bipolar disorder can be divided into two categories based on the mood episode: manic and depressive. During a manic phase, individuals may experience increased activity, energy, euphoria, or irritability, while depressive episodes may involve feelings of sadness, hopelessness, and a loss of interest or pleasure in activities. Decreased need for sleep during manic episodes. Excessive talking and racing thoughts during a manic phase. Difficulty concentrating or making decisions during depressive episodes. Changes in appetite and weight during depressive episodes. Recognizing these symptoms is crucial for the timely and effective management of the condition. What causes bipolar disorder? The exact cause of bipolar disorder is unknown, but a combination of genetics, environment, and altered brain structure and chemistry may play a role. Family history is one of the strongest risk factors for bipolar disorder, indicating a genetic disposition to the illness. Stressful life events, brain structure abnormalities, and substance abuse can also contribute to the onset of bipolar disorder. How is bipolar disorder diagnosed? Diagnosing bipolar disorder usually involves careful examination by a psychiatrist or other mental health professional. The process may include a physical examination, an interview, and lab tests to rule out other conditions. A detailed description of symptoms, including their duration and impact on life, is vital for an accurate diagnosis. Often, input from close relatives or friends is also sought to gather comprehensive information about the individual's behavior changes. How is bipolar disorder treated? Treatment for bipolar disorder aims to reduce the frequency and severity of episodes. Understanding bipolar disorder treatment options is crucial for patients and their families. Mood stabilizers are typically the first line of treatment to control manic or hypomanic episodes. Antidepressants may be prescribed to manage depressive episodes, often in conjunction with a mood stabilizer to prevent a switch into mania. Psychotherapy, such as cognitive behavioral therapy, CBT, is used to provide support, education, and guidance to bipolar patients and their families. Medication adherence is crucial, and treatment plans may evolve over time as the condition changes or in response to side effects. What are the types of bipolar disorder? Bipolar I disorder involves periods of severe mood episodes from mania to depression. Bipolar II disorder is a milder form, involving milder episodes of hypomania that alternate with depression. Cyclothymia or cyclothymic disorder involves numerous periods of hypomanic symptoms and depressive symptoms that are less severe than the manic and depressive phases of bipolar I or II. It is essential for individuals to understand which type they suffer from to seek the appropriate treatment and support. Can bipolar disorder be cured? While bipolar disorder is a lifelong condition, it can be managed with a proper treatment plan. No cure currently exists, but with effective treatment, individuals can control the fluctuations in their mood and lead productive lives. Lifestyle modifications, including regular exercise, a healthy diet, sufficient sleep, and stress management, can also help control symptoms. Bipolar disorder. Symptoms and overview. Bipolar disorder significantly impacts daily life, causing unpredictable changes in mood and behavior. It often presents challenges in maintaining relationships, job performance, and academic achievement. Those affected may experience social stigma, leading to isolation and worsening of symptoms. The disorder can increase the risk of self-harm or suicide, making awareness and proper care critical. Preguntas frecuentes sobre bipolar disorder. Can a bipolar person act normally? Perceptions of normalcy can be misleading when it comes to bipolar disorder. Individuals may not exhibit any outward signs of the disorder during periods of stability, often known as euthymia. However, without proper treatment, bipolar individuals may struggle to maintain these periods of normal behavior. Consistent treatment allows many people with bipolar disorder to have productive and fulfilling lives. What is having bipolar like? Living with bipolar disorder can be challenging as it affects every aspect of life. Extreme mood swings can make it difficult to maintain stability in relationships, work, and self-care. The disorder can be isolating, and individuals often face misunderstanding and stigma from those around them. What is it like to live with a bipolar person? Living with someone who has bipolar disorder requires patience, understanding, and education. The unpredictable nature of the disorder can create a roller coaster of emotions for both the individual and their loved ones. Support from family and friends is essential, as is their willingness to encourage treatment and help manage symptoms. What does a bipolar depressive episode look like? During a depressive episode, an individual with bipolar disorder may exhibit persistent sadness, low energy, feelings of worthlessness, and a loss of interest in most activities. These episodes can cause significant impairment and might increase the risk of suicide. It is critical for those experiencing depressive episodes to seek immediate help from mental health professionals. In summary, bipolar disorder is a complex and challenging condition with diverse symptoms and treatments. Understanding this disorder, seeking appropriate care, and maintaining a supportive environment are essential for managing its impact on daily life.